Thanks for joining SHEA's Ask the Stewie series. This series is made possible from expert members from the SHEA Antimicrobial Stewardship Committee answering questions submitted by our membership. This month, we're joined by Dr. Zanthia Wiley and Payal Patel. They're going to be answering a popular question that comes up regularly. How do you handle patients that self-report penicillin allergies? Dr. Wiley, can you get us started?
Absolutely. So I love this question. Primarily, I'll just start off back in my hospital medicine days. So I'm an infectious diseases doctor now. I started off in hospital medicine. And as I was admitting someone, if they said they had a penicillin allergy, my first question was always, was it anaphylaxis or not? And if it was anaphylaxis, I took it really seriously. And if it wasn't anaphylaxis, I felt more comfortable prescribing them a penicillin or a cephalosporin. So my infectious diseases days and stewardship days, I've kind of really changed my approach. So when someone tells me that they have an allergy, first of all, what I want to know is, what was the allergy? How long ago was that allergy? And how long after receiving the medication did you have said reaction? And what I found is that the vast majority of the time, people really don't truly have allergies. And one of the best things that we can do as infectious diseases providers and stewardship providers is to, kind of take that incorrect penicillin allergy label off. So that's how I approach things now. But Payal, what's your approach?
Yeah, that's probably how we always knew, Zanthia, that you were an ID doc in disguise, because I think, when I think back to being like a resident or, being on late at night, and someone comes in with a penicillin allergy, you may not even question it, right? And so I think, you knew from the beginning that first got to question it. And I think it's really important to have some process in mind for stewardship programs everywhere, because this is such a common thing that we see. And so first you want to have like maybe some questions that you could have your providers ask, or potentially have that in your electronic medical record, right? Because I think a lot of us have these like statistics in our head that we've like kept going forth with, but those statistics may be wrong. So I think what we're thinking of nowadays is that, for people who have true penicillin allergies, that might be 1 to 2% of the population. And of those people, very few people have cross-reactivity with beta-lactams. So you're exactly right. We should be asking these questions up front rather than going to like something like aztreonam right away. Exactly. Do you guys do anything, Zanthia, in your stewardship program that kind of helps the provider from the get-go?
Absolutely. So one of the things that we're super proud of at my institution is we've worked with our allergy colleagues and our surgery anesthesia colleagues to develop a really short questionnaire on patients who have a documented penicillin allergy to see if we can get them cephalosporins, which is first line for patients for perioperative prophylaxis. And by a really simple questionnaire, we were able to increase patients with a documented penicillin allergy from receiving 22% of them receiving cephalosporins up to over 80%. So just like you said, Payal, if you can kind of get those really simple questionnaires, and you can find them online, questionnaires of who truly has a penicillin allergy, if you can get that embedded into your electronic medical record system, talk about having the best kind of stewardship intervention ever. If you can address penicillin allergies, you can really decrease your broad spectrum antibiotic use.
I love that. So I feel like we should have a couple of takeaways for people who are listening. I think one is just figuring out if there is a process in place for your stewardship program. And if you don't have one, partnering, whether it's with allergy. Here, I know we partnered with our QI chief of internal medicine. He was here for a year, very interested in this, and we got a project going. Tons of people out there to partner with. What would you say is another takeaway, Pearl?
I would say another takeaway, Pearl, is telling your colleagues and those who are prescribing the antibiotic that as they're getting the history, that what they should try to understand is if the patient had a type 4 hypersensitivity reaction. So getting to, did they have Stevens-Johnson? Did they have TEN? Did they have DRESS? So rather than focusing on anaphylaxis, really having them guide their questions towards, did the person have a type 4 hypersensitivity reaction? And honestly, those are the people that you really have to worry about having poor outcomes with penicillin.
I love it. I'm hoping that this is going to be helpful for some Stewies out there. Thanks for talking to me today, Zanthia.
Thank you, Payal. Have a lovely day, everyone.